My name is Josh Mauderman. I'm one of the emergency medicine physicians at Meritus Medical Center, and we're in just a standard patient room, all of which are equipped with for connections for Telestroke, sort of a way that we can access neurologic specialists from different institutions so that we can get a consult and do stroke care real time in the emergency room. There are certain times when someone is having weakness on one side, but it's not fitting into a perfect sort of picture for a stroke, and we just want a little bit of help. This enables the neurologist from some other location to actually examine and interview the patient, both with audio and visual. The camera actually that you see up top here can be controlled from their home or their other location, and so they can actually ask the patient to lift their arm or close their eyes. They can examine their pupils by zooming in on their pupils, so they can do a full neurologic assessment with the help of the nurse in the room, and it basically enables our hospital to have access to very skilled, very specialized neurologists who are sort of the heads in their field in stroke care. And because of that, we have the ability to have a neurologic consult even before we have CAT scan results back, which is something that's pretty rare if you don't have this Telestroke capability. The great benefit to Telestroke is it gives us the ability to provide state-of-the-art stroke care in a smaller community. We have patients that come from West Virginia, Western Maryland, Southern Pennsylvania, almost as far east as Baltimore, who all come here as their primary hospital, their primary emergency room. So we have a large catchment area, and it enables us to provide the state-of-the-art care that you might get in an urban inner city academic center type facility. We don't have neurologists in-house all the time, but because of the Telestroke, we can get the neurologic consults often quicker than you might get in those academic facilities because they're available instantaneously. Some of the things that might indicate that you're having a stroke are focal weakness on one side, sometimes more subtle things like confusion, or if you're feeling off balance. If you go into the refrigerator and try to take the milk out, and for some reason you feel weakness in a particular hand or something like that, those can all be signs that you might be having a stroke. Inability to speak or to understand. Sometimes people can speak pretty well, but they're just not making much sense. That could mean that you're having a stroke in a particular part of the brain. Other things like being off balance or just being confused in general, all of those things could mean that you might be having a stroke. When people come into the emergency room with stroke-like symptoms, the thing that we're most concerned about is determining whether or not they have symptoms that fit into a particular neurologic distribution, so that we can see whether or not it seems like they're having a stroke. We do a quick neurologic assessment, and as soon as we identify that someone is having a neurologic problem, we sort of rush the patients to CAT scan because there's a sort of a short time window under which we can give clot-busting medication and other sort of drug therapies. Because of that, it's especially important that if you're having stroke-like symptoms, you come to the hospital early, because if you miss that window, then you sort of miss your opportunity to get the standard of care best treatment.
Why is Meritus Medical Center considered a primary stroke center?
Well, Meritus Medical Center got the designation of Primary Stroke Center through MIMS in 2007. These primary stroke centers are those facilities where when patients with acute emergency comes, they are able to get a standard of care for acute stroke emergencies. These centers are capable of recognizing signs of acute stroke, managing those patients, stabilizing patients in that facility, and if needed, these patients are transferred to tertiary care centers for further intervention.